Hello parents, I Leena R welcome you all on GenX Parenting. Now let's talk about something very common in case of children, that's falls. So in case of a fall, if the child faces any kind of a dental injury, what are the points that parents should take note of before visiting the dentist?
So this is a very good question, and I often find that a lot of parents are not aware about what all they can do to help their child. So the first thing is, if your child shows any sign of sleepiness, fainting, giddiness, bleeding from other areas, the child is chakkar aa raha hai, not responsive, not crying, then you first visit a pediatrician even if the teeth are good. If there's bleeding around the mouth and there is no other problem that you're seeing, then you can apply a clean handkerchief or a soft cloth and hold it with gentle pressure on the bleeding side for 5 minutes. Please watch the clock when you do this. You might not be able to gauge time appropriately in this stress situation. Another thing is, do visit a dentist after the fall. So they will check for any teeth which are moving, any teeth which are broken, any gums which have small bruises while the child might be having pain. They might ask you for some x-rays, and they will just do a complete evaluation to make sure that the child is doing okay and no emergency care is needed. So there might be a situation where the child falls and the teeth break. Now this could be a milk tooth or the permanent tooth. If a part of tooth has broken, do collect that part, put it in a put it in a little water, and you could take that to your dentist. The dentist might be able to fix that very part back into the child's mouth, and that will give good shape, good color and good aesthetics. Now there might be a situation where the whole tooth comes out. This can be a milk tooth or it could be the permanent tooth. If it is the milk tooth, do not put it back. Okay? Never put a milk tooth back in its place, as while doing so you might hurt the permanent tooth. If it is the permanent tooth, you can put it back. Always hold the tooth by the crown. Crown is the part that you see in the mouth. You just hold it. Wash the tooth with water. Do not try to scrub it. Just put water, drinking water for like 10-15 seconds till there are no visible debris or dirt on the tooth, and you put the tooth back. A good reference point is the tooth next to it. So you can see the surface on the front, the surface at the back, and just place accordingly, and ask the child to bite on a clean cloth or a handkerchief in that position, and take your child to a dentist. This permanent tooth can be saved many a times, and it might last your child a few years if you get your child timely help. Now while getting this tooth to the doctor, you need to store it in a medium wherein it will be wet. Never dry the tooth, never get it in a paper or a handkerchief. You can use water, just put it in a glass of water. Milk is an excellent product, cold milk. If you get cold milk easily, if you are around a medical shop, you can buy saline. So these things can be used to store the tooth till you reach the dentist. This will keep the cells alive, and hence we will get good results.
Thank you so much, Dr. Nikita. We hope you found these tips very helpful. So do like and share it with your fellow parents. For more such informative videos, don't forget to subscribe to GenX Parenting. Thank you so much.